Established in 1964, the Physiotherapy Department staged in Polytechnic of Surakarta is previously a Physiotherapy of Academic of Surakarta until 2001. I am Ingar. As your host today, I will bring you to looking around our campus with my team. Welcome to Physiotherapy Hall Polytechnic of Surakarta.
Hi guys, welcome to the next facility. This time we have the manual therapy laboratory. In this laboratory, we often use this for some practical classes such as neuromuscular, manual therapy, and then exercise therapy. We also have for some practical classes for massage, body spa, and also facial. And this time, I will introduce to you the facilities we have in this room. The first one is we have the chairs. So in case we need to listen for some lecturer before the practical class begins, we will use the chairs, and then we will use this bed as the desk or the table. And as you can see in this room full of the manual beds, which it can be moved like up, and it's not only going up, it's also coming down like this. So we can set the height as all we need and all we want. And trust me, for someone who doesn't meet the average height like me, this kind of manual bed helps a lot.
As shown, this is the practical class of proprioceptive neuromuscular facilitation or PNF, where one of the students acts as the therapist, meanwhile the other one acts as the patient. Besides PNF class, this manual laboratory also mainly used for other practical classes like massage, manipulation therapy, manual lymphatic drainage, and etc. Manual laboratory is the most used laboratory for practical classes because of the ergonomic beds, which are safe and convenient for the students.
Okay, this is our exercise therapy laboratory. There are so many facilities that we can use here. As we can see, there are a lot of tools that we can use, such as the crutches, the wheelchair, set of pads and the chair, and also there is the stairs, the parallel bar that we can use when we perform active or any kind of passive movement or exercises using resistance or not.
This laboratory is commonly used for assessment, exercise therapy, and etc. Exercise therapy laboratory is well provided with all kinds of physiotherapy modalities such as balance board, mirror for mirror exercise, stairs, and even parallel bars.
Electrotherapy is the use of electrical energy for medical device. The term electrotherapy or electromagnetic therapy has also been used for alternative medical device. And here we are in the place that we will learn all about electrotherapy. The electrotherapy laboratory. In this laboratory, we have many stuff that we are used for study electrotherapy, like TENS, US, laser, shockwave diathermy, and shortwave diathermy. Of course, we don't learn all of this at once, but we will learn it from the easiest one to the complex one.
Electrotherapy laboratory. In this laboratory, we have various electrotherapy modalities such as shortwave diathermy, ultrasound, shockwave diathermy, microwave diathermy, laser, and infrared. The student will learn how to apply them as needed based on the patient condition.
Now, welcome to the sport laboratory. Students here usually call this a mini hospital, since we often use this for sport practice. But actually not only sport. It could be used for cardiovascular, cardiopulmonary, and other subjects that needs an equipment available in this room. And now I'm going to introduce you about the equipment here. First, I have a nego cycle which I used, and then second, I have a treadmill. The treadmill is compatible with an electrocardiogram, or well known as ECG. This is the one of the treadmill that we have in sport laboratory. This treadmill is compatible with an electrocardiogram, or well known as ECG. And we have been using this as we practice a stress test for our cardio.
The sport laboratory is well provided with equipment which mainly used for athlete rehabilitation programs. So, this is where the students learn about sport physiotherapy and also cardiovascular practical class because there is ECG available in here. Designed as a spacious laboratory, this place has become the well-used room for space-needed class activities. And for your information, what you all need to know that this laboratory is not only held for the class, but we also have this open for sport clinic. This clinic held once in a week by the sport physiotherapy study club we had. The patients could come from local students, not only physiotherapy students, but also from other departments. Actually, the patients didn't only from the students because sometimes there was also some patients from outside the college. So when the patients came, it could be a way for the students to meet the real case and work on it by themselves. But actually not by themselves because we always had a supervisor who assisted the students when the clinic was open.
Okay, let's move to the another laboratory. As we can see that there are so many things like baby doll, trampoline, gym ball, and many other toys. This room called pediatric laboratory. We usually doing some class in here. And then not only sport physiotherapy doing some treatment, but the study club doing that too. Like we give some treatment for cerebral palsy patient to control the tonus, and then for another patient. In this pediatric laboratory, the student will play roles, where one of them will be the therapist and the other one will be patient. Here, the student will learn how to initiate the exercise for normal development. What's so special about working on pediatric is we need extra passion, love, and care to make the children feel comfortable around us. So the main objective of the treatment itself will be well achieved.
Welcome to the next laboratory, the hydrotherapy laboratory. We have cryotherapy. Cryotherapy can use for reducing pain, example in DOMS. And then we have paraffin. Paraffin can use for chronic pain, usually can use for low back pain. And then we have cold pack. Cold pack can use for acute pain. And then we have hot pack. Hot pack can use for chronic pain.
Cold therapy is also known as cryotherapy. It works by reducing blood flow to a particular area, which can significantly reduce inflammation and swelling that causes pain, especially around a joint or a tendon. In another way, it can temporarily reduce nerve activity, which can also relieve pain.